So the negative forces it up and down.
Hi Trina, how are you?
Good, how are you?
Good. My name's Ashley. I'm going to be your hygienist today. Congratulations on getting braces. So you had your appointment earlier a few minutes ago with the dentist and the assistant. So there's some things that I would like to go over with you and ask you some questions. Would that be okay with you today?
Yep, that's okay.
Oh, right. So my first question, did you come alone or are you by yourself today?
Well, my mom dropped me off, but she'll be coming to pick me up.
Oh, okay, great. How old are you now?
I'm 15.
15, wow. So what grade does that put you in?
In grade 8.
All right, grade 8. So you must have your grade 8 grad coming up?
Yep.
Are you excited about doing the pictures and having a dress?
Mm-hmm.
Yeah? What color is your dress?
I'm probably going to get purple.
Ooh, beautiful. With any flowers on it?
No, I want like sparkles, you know.
Oh, that sounds great. You'll have to show us some pictures. Okay, so let's dive right in. Okay, so just a couple quick questions here. So this is called a Canberra. So we're just going to assess you for caries, which is decay, and simple terms, cavities. Okay, we want to ensure what level you're at for base level, and then go from there, and then we can build a roadmap, okay, and how to maintain. So just a couple quick questions. Some of it has already been filled out with the dentist and the assistant who you saw earlier today. So now that you're in full bracket, so we did select yes. Okay, they noticed that you did have a couple restorations within the last 3 years. Do you know if that was from decay or some chipping? Do you know what happened there?
I don't know, they were just fillings.
Just fillings. All right. Okay, so there's no cavities on your x-rays, and we'll look at those again, and that there were no white spots. Do you know what white spots on your teeth are?
So
are they just white spots?
Yes. It within the same, but do you know the reasons and why they form on your teeth?
No,
if it's not from Okay, so we'll go over that for you. Okay. Now, you're 15. Look, how many times do you eat a day? Do you find yourself snacking a lot? What kind of are
yeah,
some
I
of
do
your
snack pretty regularly.
Do you have about like how many snacks a day would you say, other than your meals?
Like 2 or 3.
2 or 3. So let's try to limit that to maybe 2, and I'll explain some reasons later on why it's important to minimize the risks for frequent snacks. Okay, so that we're going to say yes to that. Okay. They did mention that you have good saliva flow, which is great. The saliva helps remineralize your teeth, so that helps make them stronger. So there's fluoride and a fluoride toothpaste here as well.
First of all, what does the negative mean?
You don't have any exposed roots. Your teeth are nice and healthy. Now, let's talk about some protective factors, okay? So I saw that from your medical, you live in a fluorinated community. Do you like to drink water at all?
It's okay, but I don't drink it that much.
Okay, so let's try to drink a little bit more, because when you're at braces, you're at a higher risk for cavities, and we want to make sure that we're getting that remineralization for you. Okay? How often are you brushing your teeth?
Twice a day.
Twice a day? Excellent. And they did tell me you are using the crest sensitivity. That's just something, is that because it's at home and it's easy to use?
Yeah, that's just what we have. Yeah.
Okay, well that's a good choice. Excellent. We'll stay with that. I think that's a good one for you. It helps reduce gingivitis and plaque as well, and it does have some mineralization and a good fluoride amount as well. So if it's easier for you, we'll just stay with that. Okay, and the dentist did say you had a cleaning before your braces, so we'll continue on with having fluoride every 6 months, a topical varnish. So see here, we have you highlighted at a high risk. All right, so nothing to worry about. It's just basically, you do have a lot of great protective factors here and a few risk factors, but the biggest risk factor here for you is that you're in full braces.
Okay.
Do you understand why that makes you a high risk?
Yeah, because they attract lots of food and stuff, and you can't brush it off as easy.
Exactly. Good. All right. So let me just go through here. Do you have any questions that I can help answer for you?
Well, like, I have bad breath, but like, like,
There you
I
go.
don't want to talk. I don't
So
like
that's
talking about it, and I don't like
exploring
talking to other people
the
either
basic
because of
curve
it. And like,
of y equals
there's this
AX
boy I like,
squared.
but I don't want to talk to him because my breath is so bad. I'm like, I wish I could do
So now,
something about it.
these
And
are
also,
different
I've noticed my
stuff.
tongue is
We're
coated,
not
which is
just
kind of
making it
weird because
thinner
like
or
I've never
wider.
had that
We're
before.
gonna move the original
Okay, so
up
some
or down.
contributing factors to why that happens
By
to
filling
you
in the table
is
of
because
values.
of your braces. So let's look at some pictures here of that. The tongue
Start like
coating
this, we just
is
plug in
because
the values again.
there's a layer of bacteria that just needs to be removed. And that acid creates volatile sulfuric acid, so then it creates a oral malodor. But it's definitely something that we can manage for you, because
Okay.
you were just saying it started with your braces. It's not to do with anything about periodontal disease or anything. So we'll just focus on some different aids in which we can help reduce that
This is the one
for
where
you.
this is called
Okay,
the
and one of
base
those
curve.
things is
This is the one that gets
making
changed.
sure we're using a tongue scraper. Okay, and we want to do that in the morning, right? So basically, it's like a little rake. Have you ever seen one of these before?
No, I haven't.
It's kind of funny contraptions. And some toothbrushes, they have it on the back as well. But this will really help aid
That's just
in
the original.
the bad breath that we want to eliminate.
Okay.
Okay. So there's this little tip there. My recommendation is to do it first thing in the morning. Drink a glass of cold water
Now, this is a
before you
little
made from the
different.
tap. That could be another source to get your
This is not a
resource.
number in front of
And
the
let's say
square,
this
but
is
there's
your
a number
tongue
after it.
here.
So let's
You
see
want to
what
maybe
happens.
just start at the
So
tip
go minus
and pull
2
forward and then go a little bit
squared
farther
plus
back.
3.
Okay?
That
So
would
do you think that's
7.
something manageable that you can do?
Yeah, I'll give it a try.
If you find that you're concerned about the bad breath, this is one tool that will
Okay.
really help for you. Okay? As well as another tip which will help is brushing 2 to 3 times a day. Basically because as you can see here, there's this buildup of the oral biofilm that also creates the odor. And same with not interdental cleaning, which means cleaning in between your
And then you
teeth.
plot these
So
points.
again, as we mentioned, the white spots,
So
this
0,
is
0,
from
0,
when
0, 3.
acid plaque and biofilm has been left on your teeth for too long. The byproduct of bacteria, their poop, is acid. Alright, so we want to make sure that we don't leave this sort of debris on our teeth, right? So look how swollen that gingiva looks, right? So I know the dentist, this is another severe case.
These
This is
have the
something
same
we
shape.
definitely want to avoid. You're a
No,
beautiful,
this
smart
one's
woman.
not stretched.
We don't want your braces to come off in the
Well,
next
what's
year and
happened
a half
to
to 2 years and have this,
Now this
right?
one happened
It's
to
a lot
this.
of money, time, and effort.
Compared to this.
So let's
Yeah,
work
but what
together
if you
and
go up
try
and
to
down?
eliminate situations like
Sure,
this.
if it starts
So these are from earlier
Yeah,
today.
but
They
this
did a
one starts
disclosing
there,
solution
and
for
what happens
you.
to this is it goes
So
up on
this is
units.
before you brushed
Pretty
your
well.
teeth. You can see a little bit of the plaque and bacteria there. Can you see that, Shreya? Excellent. And then they applied the disclosing solution.
From here.
And then this
1,
was
2, 3
afterwards,
minutes up.
right? After they did the polishing
So
for you.
Yeah.
So what do you notice in
So
this
what do
picture
you think's gonna
there?
happen here?
All the blue like in between my
By how many
teeth is
units?
bad.
Very good.
That's the bacteria. So that is all the
By 3
materials
units.
that lead to
Okay.
cavities and to
Let's see if it
bad
does.
breath. So we want to make
You
sure
do the same
that
thing.
we're doing the best we can in removing all of that. Okay. So we have some aids here in which we can help reduce the effects. So the first thing I would like to know is, can you demonstrate how you brush your teeth right now?
Sure. I just go like straight across like that.
And do you find it's effective?
I mean, I don't know. I brush my teeth. I can say I brush my teeth.
That's great. So what I would recommend here is called the Charters
So now
method,
let's see
okay?
what happens.
Everything that I'll show you today, I will email you some information, and it is on our Instagram, so then you can have that as a reference tool, okay? So if you look at your teeth here, we want to go at a 45-degree angle, okay? And we want to go and hit the crown of the tooth so it'll hit the gingiva to stimulate. Now your gums may bleed for a little bit, maybe a week to 2 weeks, but that's normal.
Okay.
They will toughen up. They just
So
need to
what
be a little bit
happened here
exercise.
is
No,
this one went
don't
down.
keep brushing just because you see a little bit.
Okay.
It's like starting a new sport. You're not going to be good
So
at
by
it. You need to
doing
build
that,
up
observing
that
what's
muscle
gonna happen
memory,
here
okay?
to this
And then
group.
once you get good at that, we can even, what we call a modified
What's
charters,
gonna happen
is
here?
when we just roll it out.
Right. So
Okay,
the
so then
original
push all that
units,
bacteria out and
if
into
it goes down,
your cheek
it's
here.
going to be
and
There's
into
your
these
original
crevices,
vertex,
which will be,
0, 5,
you know,
because this is
spit
0, 0.
out as
That's
well.
the original vertex.
Another thing I would recommend for you, you have
This one goes up
beautiful
5.
lips. So just pull
This
down
one
that
goes
little lip
down 2.
and just brush there so you can
That'd be
access
0
that.
minus 2.
Okay.
Another little technique, see when you open your mouth all the way, you stretch out your cheek, right? So there's no flexibility. So close your mouth halfway and then put your toothbrush into the back, and then you're able to get all the way back
So
in there
these are
to
called
the very last tooth, right?
Yeah.
So
Excellent.
you start off with your
So is that
base
something that you'll be
curve.
able to
I'll
handle?
try that brushing technique.
your
It'll
base
probably work
curve.
better.
It'll be,
These
it will
are
work a
wider
lot
than-
better. Now this method I did show you is only for when you have braces.
Upward.
When we're done and you know your braces are removed and your beautiful teeth are showing, I'll show you a new one that you can carry on for life. Okay? Also another thing to help with the interdental care, which is in between your teeth, is using floss. Do you use any kind of floss, like soft picks or anything?
I use like some type of floss, but like I know you're supposed to go like underneath your wires when you have braces, but I haven't ever done that.
Okay, so we'll show you how to do that with some videos, which I'll link, as well as these are easy threaders. They're a little bit thicker, so they're harder at the end, so you can pull it through your braces. And then there's a string here, which will go in a curved shape. So what I'll do is, if you don't mind, would you like to see some videos?
Yeah, that'll be helpful.
Excellent. Let's just play these ones as well
That's your
for
K line.
here.
It's called K line.
So we'll just pull that up
That's the
here.
notation you use. So just take the original and take.
So just going, this one's doing the circular motions, but I want you to do these motions here as we described, right? See how going on the top and the bottom on that 45-degree angle so they can remove all the plaque. And these were the pits and grooves and fissures, your biting surfaces. Want to make sure that we're brushing that as well.
Use these points for
That's that
X and Y,
sweeping
plug it
motion
in
out,
here.
it's the modified.
So this is minus
And then
2.
cleaning the tongue as well. So another aid that I'll give you here is a Curaprox, and that'll help get in between those brackets for you to help remove all the debris as well. And there's even some that can go in between the teeth. And so this is the demonstration of this floss here, the Easy Floss thread. We can also, it's the same method, which I'll show you as well with the Super Floss, okay? Excellent. And then there's some foods that we do recommend, which we did tell you earlier about it. And then also there's another video that I would like, or another product I'd like to show you. It's called a water pick. Okay, so what it does, it just shoots out the water and it gets rid of all that bacteria for you. And if you look on Amazon here, it's at a great price point for you, okay? So this will really help get rid of all that bacteria and in between your teeth, and that will help control that bad breath for you.
Okay.
Okay? Let me just go here. So also, I just composed a little bit of information there for you. So this is like the Easy Through Floss, which we would like you to use. And it's all on Amazon. Do you have an Amazon account?
My mom does. I'll look on there.
Alright. We'll also email this to your mom as well. And if she has a few minutes, she can even call me. We can go over some of these techniques and recommendations as well. We did tell her earlier that we'd like you to come in every 3 months, and she was okay for that as well. So that consent has already been provided for us. And then again, there's a variety of different aids there for you. Okay? Do you have any other questions for me?
See how this
I don't think so. I think that was really good. I'll definitely be trying the tongue cleaner for my bad breath, and the new brushing method should help.
Yes, and as well as I'll give you all these interdental cleaners and tongue scraper and a new toothbrush. And I want you to make sure that you are replacing your toothbrush every 3 months. So you'll be getting a new one anyways when you come in for your cleanings. And also if you can probably have your own toothpaste, because the bacteria spread really quickly. So if you can have your own, that'd be just fine. And your bacteria is a fomite for your toothbrush. So you want to make sure that you're air drying this and keeping it in a separate area. Okay?
I'll try that.
And then this is a mouth rinse. If you're in school and you're a little bit concerned about your bad breath, right? You don't want to always brush at high school, maybe. So I'm going to recommend Listerine Zero here for you. So you can see it's an antiseptic mouthwash, and it kills 99% of germs that cause plaque, gingivitis, and bad breath. So this is good. Just swish it around for about 20-30 seconds, and then spit out. Don't rinse afterwards, because then you will wipe away all those active ingredients. Okay?
It's probably something I can try like after lunch at school.
Yeah, absolutely. Yeah, it just helps get rid of everything for you. And if you have any questions or concerns, we're here always to answer your questions. It was lovely to meet you. Thank you. Have a good day.